Okay, hi, I'm Jordan. I'm going to be doing my abdominal and pelvic video. I'm going to go ahead and scan the room and make sure that there's no notes because we can't find Mr. Filey. So, nothing over there. Sorry. Okay. Shh. Okay, so first thing I'm going to do is I'm going to check the chart, provide for privacy, wash my hands, identify the patient with 2 identifying factors. Hi, my name is Jordan. I'm a street nurse. Can you tell me your name and date of birth?
Olivia Skaggs, 3294.
Okay, good. We're just going to do kind of a pelvic and abdominal assessment on you today. Have you had any history of trauma to your stomach?
No.
Any surgeries?
No.
Okay. Do you have any issues going to the bathroom?
No.
How often do you use the bathroom?
At least once a day.
Okay, and do you know the color of your stool?
It's usually brown.
Okay. Is it like formed or is it liquidy?
It's usually more formed.
Okay. Any strong odors or anything like that?
No.
Any pain or urinate when going to the bathroom?
No.
Any urgency or anything like that?
No.
Okay. So the first thing I'm going to start with is auscultating the stomach, and I'm going to check in all 4 quadrants and listen for bowel sounds. If I didn't hear, the maximum I'd want to listen to would be for 5 minutes. If I didn't hear anything in 5 minutes, we'd have a problem. I'd like to note that the stomach is flat. I'll lift it up here. Okay, there is a little bit of striae, I see. Doesn't look like there's any scars or anything like that. It is flat. It's pretty symmetrical. I don't see any bulges or anything like that. It is warm and dry. The color is appropriate for ethnicity. So what I'm going to do first, I'm going to check for bowel sounds in in all 4 quadrants, 2 different places.
Thank you so much, ladies. I really appreciate it. In lab in the morning.
And then any for press this in there.
Oh, you got it. Oh, okay. So now what you do? This is how I do it. There's 2 ways you can do it. Yeah. So go to your
Gina's my YouTube lady.
So when you go to your video, look how happy you look.
No. I actually sound great. Look at Anne. Look how cute she looks. I look very creepy. I'm really sort of. I know.
So you push share. No. Sure. You share. And then you take this link. Nope.
Okay, I did hear bowel sounds in all 4 quadrants. What I heard was kind of like a tinkling, movement sound. Next, I'm going to auscultate the abdominal aorta. So I'm going to take my hands like this and place it above the belly button, and it's just left to the midline of the aorta. And these 2 things right here are going to be my renal arteries. So I'm going to check and make sure that there's no bruise on that. And I'm going to use the bell. I don't know how loud I said that because I have my stethoscope on.
I have the edge line, so you don't have to hear my thing, so that when you click on mine, you can just view it right there. You don't have to go to the extra line. Embed it. And how you do that is you do
Okay. I didn't hear any bruise, and I would say that the pulse was about a +1. It wasn't super loud. Don't see any pulsating in the stomach or movement or anything like that, so that's good. Next, I'm going to check for the iliac. I'm going to do my hands like this again, and I'm going to go at these 2 points right here on the stomach. And again, I'm listening with the bell. And I'm starting my V from the belly button and both things. I forgot to mention
Is
that.
that touchscreen? Yeah, touchscreen.
Can't you see on my fingers? I need to clean that touchscreen. I can see it in the lighthouse.
I was
bad it
wondering,
is.
because I went to like look at something and it did something. That's why I was like, is that touchscreen? I didn't mean to do that.
So then when I was at work, I always touch the screen and it didn't work.
Mm-hmm.
Oh, I gotta change that. Alright. Alright, I didn't go eat lunch. You guys getting lunch? I didn't is the
Deep breath, take 30 seconds.
Phew! Oh my gosh. That was deep.
I don't, is the
Philosophical
Okay,
sneeze.
again, no breweries were heard, and I think it's about a +1 on the pulse, not super loud. So next I'm going to go to palpating. First I'm going to start with a light palpation. I'm going to go to a deep one as long as there's no pain. So are you having any pain in your abdomen right now?
My sinuses just got a little tore up.
Or actually I'm going to percuss. Sorry. I'm going to percuss first and make sure that I'm hearing like resonant sounds, unless we're going to be over like the liver or the visceral organs. So,
Yeah, you two optional. Yeah, okay.
Thank you.
Oh, okay.
okay, I do hear a little bit of a dullness right here, but there's some organs there.
Good. Look. You got this. All right.
And I'm kind of going like in a clockwise motion around the belly button. Okay, there wasn't any dullness that I heard. It was pretty resonant. I'd also like to note that the umbilical is midline and that there isn't any bulging or anything like that. So now I'm going to go to the light palpation, and the patient already stated that she has no abdominal pain. So I'm still going to take care, but we don't have any areas that I avoid or want to come back to now. So just let me know if you have any pain or tenderness. Okay, did you have any pain or tenderness at all? Okay, so now I'm going to go for deeper palpation. And let me know if you have any pain or tenderness. And as I'm doing this, I'm going to be watching the patient's face and making sure that she's not making any grimacing faces that point to the fact that she's uncomfortable. Okay, I don't feel any lumps or hard masses or anything like that, so that's good. Next, we'd go down to the pelvic region, and I would be assessing, for any lumps, any discoloration, any abnormal warmness. I'd want to make sure that it was warm and dry. I would then palpate, I would percuss, and then palpate and make sure that there was no lumps or masses down there as well. And then I would ask the patient to roll over, and I would examine the anal area. I'm going to ask her if she's had any issues going to the bathroom, any pain or burning sensation when passing a bowel movement. I'd be wanting to look for any bulging when I asked her to bear down. I'd be looking for any redness, any rashes, any lesions, anything like that, any excessive moisture, anything like that. Again, I would ask the patient about her menstrual period, any pain that she's having or anything like that. So I'm going to go ahead and chart what I found, and you take care. Is there anything I can get you?
Nope.
Okay, thank you.
Thank you.